Every minute, somewhere in the world, a family hears words they never expected to hear. Memory loss, cognitive decline, dementia. And most people assume there is only one explanation: age. But what if I told you that for millions of people, the trigger was not age at all? It was a medication, a pill they trusted, a treatment they were told was safe, something taken every day, sometimes for years, without a single warning about what it could be doing to the brain. I am Dr. James Parker, and for over 15 years in clinical practice, I have watched this pattern repeat itself across countries, cultures, and healthcare systems. Sharp, independent adults slowly begin to change. They forget names, they lose focus, they feel mentally slower, less present, and almost everyone around them says the same thing: this is just part of getting older. Often, it is not. Today, I am going to walk you through 9 widely used medications that research has linked to rapid memory decline and dementia-like symptoms. We will count them down from 9 to 1. Some of these are prescribed every day, some are sold without a prescription, and one of them is so common that many people do not even realize they are taking it. Pay close attention to number 3. It is often given for a problem that sounds harmless, yet it may be quietly affecting the memory centers of the brain. Before we begin, take a moment and tell me in the comments: how old are you, and how many medications do you take daily? I read them, and your answers guide what I cover next. Let's begin. Number 9, diphenhydramine. You may recognize this medication under many brand names used for allergies, colds, or sleep. It is often taken because it is inexpensive, widely available, and does not require a prescription. That combination creates a dangerous assumption that it must be gentle. Inside the brain, it is not. This drug belongs to a class called anticholinergics. That means it blocks acetylcholine, a chemical the brain relies on to form new memories and stay mentally alert. As we age, the brain naturally produces less acetylcholine, so when a medication blocks it further, the impact becomes stronger, not weaker. Research has consistently shown that long-term use of anticholinergic drugs is associated with higher rates of memory loss and dementia. The risk is not dramatic overnight. It is slow, subtle, and easy to miss. If you use medications labeled nighttime, PM, or certain allergy formulas, this is one ingredient worth checking carefully. Number 8, proton pump inhibitors. These medications are used to reduce stomach acid and are commonly taken for heartburn, reflux, or indigestion. They are effective, and because symptoms often return when people stop them, many stay on these drugs for years. Here is the issue: stomach acid is not just discomfort. It is necessary to absorb key nutrients, especially vitamin B12 and magnesium. Both are essential for nerve health and brain signaling. When these nutrients drop quietly over time, the brain may begin to misfire. Confusion, memory slips, and mental fatigue can appear and mimic early cognitive disease. Long-term use has been associated in multiple studies with increased risk of dementia-like decline, especially in older adults. The goal with these medications should always be the lowest effective dose for the shortest necessary time. Number 7, bladder control medications. Drugs prescribed for overactive bladder are often life-changing in terms of daily comfort and dignity. However, some of the most commonly prescribed options work by blocking acetylcholine, the same memory chemical affected by earlier drugs on this list. These medications cross into the brain easily, and with prolonged use, they have been associated with confusion, forgetfulness, and reduced attention. What makes this particularly concerning is that cognitive symptoms are often blamed on aging rather than the medication. In many cases, safer alternatives exist that do not affect the brain in the same way. Number 6, certain cholesterol-lowering medications. Cholesterol is often viewed as the enemy, but the brain itself is made largely of fat, and cholesterol plays a role in building and maintaining nerve insulation. Some cholesterol-lowering drugs cross into brain tissue more readily than others. In susceptible individuals, especially at higher doses or with long-term use, this has been linked to brain fog, slowed thinking, and memory lapses. This does not mean these medications should be stopped abruptly. It means cognitive symptoms should be taken seriously and discussed openly. not dismissed. Number 5, benzodiazepines. These medications are commonly prescribed for anxiety, panic, and sleep. Initially, they can feel like relief. The nervous system calms. Sleep comes easier, but over time, the brain adapts. Long-term use has been strongly associated with cognitive slowing, impaired learning, and increased dementia risk in older adults. The brain essentially remains in a sedated state, less able to form new memories or respond flexibly. Stopping these medications suddenly can be dangerous, which is why careful medical guidance is essential. Number 4, older antidepressants used for pain or sleep. Some older antidepressants are still prescribed for nerve pain, migraines, and insomnia. While effective, several of these medications have strong anticholinergic effects. Taken nightly for years, even at low doses, they can gradually reduce memory, concentration, and mental clarity. Because the change is slow, people rarely connect it to the medication. They assume it is age. Number 3, a specific antidepressant, often overlooked. This medication is widely prescribed for depression and anxiety and is often viewed as a modern, gentle option. What many people do not realize is that it has stronger anticholinergic activity than others in its class. Studies have shown measurable declines in short-term memory and attention within the first year of use in older adults. It stands out because safer alternatives exist within the same category, yet this one is still frequently chosen. If memory changes appear after starting treatment, they should never be ignored. Number 2, antipsychotic medications used off-label. These drugs were originally developed for severe psychiatric conditions. Today, they are often prescribed off-label for sleep, agitation, or behavioral symptoms. They strongly suppress dopamine, a chemical involved in focus, motivation, and planning. In older adults, this suppression has been associated with faster cognitive decline, increased confusion, and loss of engagement with surroundings. These medications should be used with extreme caution and only when clearly necessary. Number 1, anticholinergic polypharmacy. This is the most overlooked risk of all. Not one medication, but the combination of several. Each drug may carry a small cognitive burden on its own. Together, they stack. Sleep aids, bladder medications, older antidepressants, all blocking the same memory chemical from different directions. The brain does not adapt well to that. Research shows that high cumulative anticholinergic exposure dramatically increases dementia risk, and most people have no idea they are affected. Here is the hopeful truth. Medication-induced cognitive decline is often partially or fully reversible when caught early. The brain is resilient, but it needs help. The most important step is a full medication review. Prescription drugs, over-the-counter products, and supplements evaluated together, not in isolation. If you take one thing from this video, let it be this. Memory loss is not always destiny. Sometimes it is chemistry. Tell me in the comments, which of these medications surprised you the most? Have you noticed mental changes after starting a new drug? Your experience may help someone else recognize the signs earlier. And before you go, there is another place your body often sends early warnings that most people never notice. Your hands. In the next video, I will show you 4 changes in the fingernails that can signal deeper health problems long before symptoms appear. I am Dr. James Parker. Stay sharp, and I will see you there.